Welcome everyone to today's webinar, Reimagining Your RCM Strategy in 2023 with Intelligent Automation. On behalf of Becker's Healthcare, welcome and thank you for joining us today. Before we begin, I will walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Lastly, if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box. At this time, it is my pleasure to introduce our presenters, Kristen Blanchett and David Suget-Pibble. Kristen leads the revenue cycle team at Care New England with a vision of increasing efficiency and effectiveness while creating a positive patient financial experience. With more than 15 years of experience, Kristen has worked for the past 7 years at Care New England in various leadership roles. Previously, she held patient accounts and financial services roles at various organizations in Connecticut and Rhode Island. Kristen has both a bachelor's and master's degree. David leads the development and growth of revenue cycle solutions at Notable, acting as a subject matter expert and advisor to leading health systems. He leverages digital solutions and automation to improve patient outcomes, increase operational efficiency, and drive financial performance. Prior to Notable, David partnered with organizations to increase net patient revenue through performance improvement engagements as a revenue cycle consultant. Kristen and David, thank you so much for joining us today. I will now turn the floor over to you.
All right. Happy New Year, everyone. Thank you again for joining today's webinar. For our conversation today, we'll discuss the following items. The first will be 2023 revenue cycle challenges, how our partners like Care New England utilize intelligent automation to address these challenges. Third is looking at strategies for organizations to use intelligent automation to power growth. And finally, leaving some time at the end to open up for Q&A. So as we think and reflect back on 2022, some common issues became quite prevalent across the provider organizations. Through discussion, research, and surveys, there's been 4 recurring challenges that impact the revenue cycle as we enter 2023. First is that health systems will continue to face negative operating margins. Second, staffing issues and shortages will be an issue and continue to persist. Third, growing front-end denials will increase the probability of write-offs. And finally, patients will have higher expectations for their financial experience. And as we jump into the first challenge, if we go to the next slide, what we've seen consistently and read through the published headlines is that more and more organizations of various sizes are posting negative margins in 2022. And the compounding months of poor margin performance signals that there's many challenges ahead. And as you can see in the data table below, environmental and internal setbacks have induced strain on healthcare organizations. Although these trends have slowly improved over 2022, provider organizations are taking a closer look at service lines, expenses, and making strategic yet difficult decisions on how to maximize these operations. So when I think about organizations working to recover from negative operating margins, it signals to me that the revenue cycle process has to be tighter than ever. Every single dollar and every single account matters. Revenue cycle challenges will no doubt intensify, and the status quo for solving for these problems can often be short-term solutions that don't scale towards the future. And in a study shared by Kaufman Hall in their 2022 State of Health Performance Improvement Report, it states that 67% of revenue cycle leaders have reported an increase in claim denials and an increase in bad debt. So not only are we seeing an inconsistent change in payer mix and reimbursement, but we're also seeing how insurances have changed the way they've insured patients. The changes in payer mix have been reported to have lower commercially insured, higher percentage of Medicaid, and a higher percentage of self-pay and uninsured. Patients that are insured, however, are choosing a higher deductible plan to maintain the cost of insurance. But as a result, many of these individuals may have difficulties reaching those deductibles when services are rendered, leaving providers with the challenge to collect on higher deductibles. So with that, I'd love to pass this over to Kristen. I would love for her to share more about Care New England and how she's looking to tackle these challenges as we go into 2023.
Thanks, David. So to talk a little bit about Care New England, Care New England is comprised of 6 operating units for both acute care and specialty services. CNE is dedicated inpatient and outpatient behavioral services at both the Providence Center and Butler Hospital, while Women and Infants is our primary obstetric hospital and the largest neonatal care unit in the region. Our general acute care hospital is Kent Hospital. We have medical, surgical, and rehab care there. CNE's VNA, which is our Visiting Nurses Association, provides a broad spectrum of home health, hospice services for adults, and also terminally ill. Lastly, Care New England has a medical group with over 500 providers who provide primary care and specialty services in locations throughout the state. Care New England has remained a trusted choice for almost 2 decades now, providing a leading voice in the ongoing effort to ensure the health of all the communities we serve in Rhode Island.
Awesome. Thank you for sharing that information, Kristen. I'd love to just take a moment now to just talk with you through, getting your perspective on different challenges and strategies as we go into 2023. So I think the first question I'd love to ask you is, what's your perspective and on your top revenue cycle challenges and strategies that as we go into the new year?
Yeah, access automation, and as it is for everyone, denials decreasing. Without access that is simple and straightforward, providers will lose patients that need and yet won't seek care. The results could be drastic, and it could contribute to overwhelming our ERs and even hospital readmissions. And then the negative downstream consequences are pretty vast. It is so important to bring ease and comfort to that for patients early in their care so they don't have to make that type of decision. And my top concerns revolve around being able to achieve that access for patients in an efficient and technologically advanced way. Another major concern we're all experiencing is staffing. That is where my hopes for automation come in. It's really hard to find staff in a climate that is changing seemingly daily, and the work itself is actually really tough. So the burnout and frustration is real, even for non-clinical healthcare workers. So we are finding people are seeking something other than this type of environment. Automation can help alleviate that problem on organizations if it's done well. And then my last concern surrounds denials and then the efforts to reduce them, obviously. So denial rates are increasing nationally, everywhere you read, and there's many reasons why. It's inconsistent and at times conflicting insurance payer requirements that are causing a burden on providers that are causing some of those denials. The requirements are not the same across the board and differ even at the product level, and then sometimes at the benefit plan level with the employer. So in order to get ahead of this, capable staff are a necessity for accurate scheduling, reminders for the scheduling, registration, authorization, and charging. So it's really a never-ending struggle that we experience.
Yeah, and it's everything that you mentioned there. Denials, right, is everyone's least favorite word these days. So, hearing your strategies and focus for 2023, I would love to understand, where the top KPIs are you using to follow along with those strategies.
Yeah, we have many KPIs here. I think it's something that someone like me likes to look at all the numbers, see where we're moving, where we're improving. But 2 that we hone in on are denials and write-offs. So where are we failing and where have we not yet made a difference? So root cause analysis is incredibly important to develop paths to decrease and stop the denials and essentially avoid that write-off as a loss to the organization. The efforts involved in this are huge, gathering the data, making it meaningful, and then sharing back to the owner and working to develop that process plan. Each year, it proves to be increasingly tough.
Yeah. And, I think this goes into my next question then, right? I mentioned earlier that there's a really big change in the payer mix affecting organizations these days. And, with those payer mix changes, it affects things such as prior authorization requirements or facing populations with higher deductibles or more self-pay or uninsured, like I mentioned before. So, Kristen, I would love to just get your thoughts on how have your organization faced these challenges, or have they?
Yeah, so having an acute care hospital, our payer mix has changed along with everyone else, probably nationally, to managed Medicare versus fee-for-service Medicare. And that change is affecting everyone because of the authorization requirements, because of the payer-specific requirements that you didn't necessarily have with Medicare fee-for-service. So it's contributed to some of the issues I previously talked about. So none of this is getting easier, it's only getting more difficult.
Yeah. So I think too, revenue cycle, like I mentioned, just plays a greater role more than ever in this time. And it's not only just impacting finances, but the operations and the patient experience. So I'd love to hear from you. How are you looking to address this across your revenue cycle for things such as AR review or reducing revenue leakage and bad debt?
Okay, so I'll start with your AR question because the AR is my favorite. The AR trending is important, as the KPIs mentioned. It's where you find your payer trending, your aging issues. And Care New England does have strong processes surrounding that internally, to which we communicate with the payers often, and we identify the issues and then collaborate with them directly on improvements. Those relationships are so important and have proved successful in moving our AR to payment. And we're able to do this because we use a contract management system that has been integral to that success. Revenue leakage is a bit tougher because it comes from a large number of quote unquote inputs across the system. So you have a number of departments that are inside your facilities, maybe outside of the medical group. So there's, for Care New England, we have dozens. So we've made great strides the last year in identifying those areas. And our continued strategy will be to utilize our EHR systems to assist providers in closing encounters timely and appropriately. And clinical staff, they really shouldn't have to worry about this type of information. So the more that we can build systematically to aid them in meeting all compliant regulations, drop a charge and all of that, the more they can focus on care. It does tend to be another obstacle that organizations are up against. And then the last thing you, I think, mentioned was bad debt. So our reduction strategies there will relate back to what we discussed earlier. The more information we can get from the patient about their care and financial responsibility in that care, the more successful we'll be in collecting their portion, and the encounters will not generate over to bad debt.
Yeah, no, I love that strategy. And, in the classic revenue cycle world, everything just starts in the front, right? Whatever you can get in the front within your firm control is what you want to get right the first time. So again, I really appreciate you sharing your top focus areas and strategies for your rev cycle. But I think I would love to transition now to the next challenge that many organizations are facing. And that's, as you mentioned as well, staffing shortages and issues. So that challenge of staffing shortages is something I consistently hear across the market, speaking with current and prospective partners, with the difficulties of hiring and retaining staff. Staff hiring has been difficult as the pandemic has actually opened up many doors and new possibilities for staff to work remotely across state lines or even switch industries completely. And retaining talent has been difficult as well, as these staff members are finding out through word of mouth, recruiters, or peers that other industries are paying more, less stressful, and present newer exciting opportunities that they probably would not have been able to achieve or get in a traditional provider setting. So these individuals have the opportunity to not only transition to a different role, but also potentially receive higher pay and potential better benefits. In a Kaufman Hall report for healthcare performance improvement for 2022, it was noted that staffing challenges are impacting all areas of the provider processes. And these are not just, individual issues. There's just not enough candidates available to fill these empty positions. One example is that there is an acute problem in nursing. And it was found through the study that 2/3 of respondents report that staffing shortages have required their facilities to be run at less than full capacity. And without adequate staff and these facilities running at reduced capacity, this results in delays and discharge for patients from inpatient care. Hospitals are struggling to discharge patients due to internal labor shortages and shortages in post-acute settings. The struggle to discharge patients have led to an increased length of stay by 69%, as you can see in the table above. And then how these longer lengths of stays and longer inpatient stays don't attribute necessarily to additional revenue. It's actually just taking up more time and financial resources. And you could see this effect outside of inpatient stay. It's presenting itself in the ED. Patients have reported an increase of leaving the ED without being seen by 51%. Observations length of stay have increased by 47%. And the need for organizations to rely on contract labor have resulted in labor costs that are simply unsustainable for the long term. So not only are we dealing with staffing shortages, but as Kristen mentioned in her strategies discussion, the quality of resources available to fill these patient-facing jobs is also scarce. One of our partners highlighted the fact that people are joining healthcare because they're looking for another job, not necessarily because they want to work in this industry. So a lot of the soft skills that are needed to guide patients through the system are missing in a lot of different areas. And according to an MGMA survey back in early 2021, we see that almost 60% of respondents stated employees are leaving to get better compensation. 21% were burnt out, and 7% took retirement or decided to retire early. And some other top reasons not noted here are that staff were leaving temporarily to care for family members due to the pandemic, or their desire for a remote job and opportunity really sparked them to prefer that over in-person work. And then finally, relocation because of a spouse or partner's job change during the Great Resignation has allowed them to move forward easily and upwardly mobile. The struggle to recruit and retain staff have led organizations to pursue a wide range of recruitment and retention strategies. And all respondents have adopted at least one recruitment or retention strategy, and almost 98% have raised their staffing salaries or minimum wage in result of it. A majority of respondents have introduced signing bonuses, increasing opportunities for remote or hybrid work, schedules, again, retention bonuses to keep current staff happy, and creating a more attractive shift differential to alleviate off hours and weekend coverage for staffing challenges. Less common though, we're still seeing folks in the industry pursue a significant portion of their time or financial resources towards providing overtime and restructuring the work week to reduce commuting hours and offering subsidies for commuting, childcare, and other work-related expenses, especially if they choose to be remote. So with that, Kristen, I'd love to just double click into this a little bit more with you on what staffing challenges you're dealing with at Care New England and what strategies you've used to solve for this best you can. So first, I'd love to ask you, if you could tell us about your team prior to the Notable partnership and how many staffs were dedicated to notification prior authorizations?
Sure. So prior to Notable, our authorization team was operating down about 3 full-time employees. So we were basically understaffed over 100 hours of productive time per week. We otherwise have 14 staff now that are dedicated to admission notifications and prior auths across our system. To give some volume to correlate, we have 507 beds, and they need review for notification at every single admission and every level change, along with outpatient visits for radiology, cardiology, and surgical. And we have about 14,000 surgeries per year. So based on those numbers, you can tell being down staff 3 FTEs is a really big deal for us.
Yeah, definitely. I would love to find out, how has the staffing model changed since you partnered with Notable?
Yeah, our staffing complement actually hasn't changed. We never got those 3 FTEs back and remained at 14. However, we've been able to make so many operational improvements because of Notable and be more prepared in that manner. After implementation and collaborating with Notable, an LOA or a vacation was not a frantic super stressor. So we were able to increase staff capacity. We were able to finally cross-train the staff, which we've never been able to do. And we could appropriately reallocate work. So we could shift focus to the more difficult work, such as pairs that require you to pick up the phone or need manual intervention. Most notably, we were able to create room in this team to take on responsibilities for the No Surprises Act, some new regulations that were put onto facilities. It would not provide revenue to the hospitals, yet required FTE time. So it was really hard for a struggling organization to rationalize hiring people and not getting revenue back for them. The volume shift of work over to Notable made those hours possible within that team. It did not cause Care New England to hire new staff as a cost to the organization. So it all worked out very well.
That's awesome. Especially during the holidays when you have people taking off PTO, it's just a constant reshuffling for your managers and leads to figure out what's the right coverage to ensure that we don't miss anything. And I'm glad that, through a partnership with Notable, you've been able to achieve other major successes outside of just covering for staffing shortages. So I think the last question I have for you in terms of staffing shortages is I would love to hear your strategy for driving staff retention and what you've done at Care New England for that.
So staff retention is really tough in our environment. As things change in the industry, we have to attempt to move just as fast. Most people generally don't like change at all. So that's an interesting challenge in front of us. Our efforts have focused around work from home, staff recognition, and then operational improvements. So our revenue cycle team was able to move to a hybrid in-office and work from home model, which I think was the thing that made the most impact for us in boosting staff retention and morale. Additional automation successes will increase the ability to work from home too. So the more that we can do that, I think that's where we're going to continue to focus to try to, ease the staff into working from home more often.
Yeah, no, that's great. So thank you again for sharing your insight and actions for the staffing challenges. I think I'd love to go to the third challenge now, which again, like I mentioned earlier, is everyone's favorite topic, which is denials, and specifically how front-end denials are increasing your probability of write-offs on the back end. So what we can see here is a national denial trend analysis that included approximately 441 million claim remits that were valued around 500 billion in total charges, and this spans across 1,500 US hospitals. And in this graph, we can see that the average denial rate is up 33% since 2016 and hitting 12% of claims denied upon initial submission back in 2022. And in recent trends, payers are asking for more itemized bills or medical records at a higher rate. In the second half of 2019, claims denied for medical records were at 8%. And then the first half of 2022, we saw that jump up to 14%. That's a 75% increase. And when I talk about that increase, that's just not denials, but think about the work it requires for your staff to request those itemized bills, to maybe flag someone from a different department to get that over or sent over, or your staff shuffling to find that information and get it appealed and sent over to the payer. So working with various organizations, I've seen a proactive approach taking place where they've proactively tried to send these itemized bills or medical records ahead of time for high dollar claims, but it hasn't yielded much value as anticipated, only because the feedback they would get is it doesn't matter. If the claim has to go through adjudication and it denies, and once that denial hits, that's when the information will need to be sent. So being proactive isn't providing as much relief as originally intended. So if we were to take a step back and we looked at the denials by the front end, mid rev cycle, and back end rev cycle, we can see that 41% of these denials are due to front end errors. And in most cases, these are preventable errors. But if we also did a deeper root cause analysis to understand what are the trends that we're seeing within these denials, there's 4 key components that we've identified. First is that there's a lack of resources. In the front end, there are not enough resources to accurately input the criteria to process a claim timely. And as a result, your back-end staff have to allocate their time to do what the front-end resources were short-staffed on being able to achieve and complete on their end, which is adding to the additional responsibilities that the back-end staff already have. And then, like we mentioned in the previous section, the staffing, attrition, and training. The competitive market today makes it challenging to hire and retain qualified staff. So when you hire new staff, these resources need comprehensive training and constant retraining to ensure that they do the right things for the patient and to the correct information within the discrete fields of the EHR. This in turn has increased the denials backlog, and it affects the timely filing deadlines. With the absence of a denial prevention strategy, we're only seeing denial symptoms being addressed. And this actually causes organizations to be in a continuous loop of denial challenges. And last, most organizations don't have state-of-the-art technology to help them optimize and automate processes. This prevents organizations from getting out of that vicious loop that I mentioned and always trying to catch up, forcing them to work harder and not smarter. If we were to double click and look at these denial reasons a little further, registration and eligibility errors really stand out at around 22%. And although this type of denial isn't a new challenge for medical practices, the current labor market has put a burden on practices with poor processes. And other top denial reasons for organizations, as you can see on this graph, are authorizations and pre-certifications, averaging around 13%. And this has been difficult for organizations to navigate as changes or requirements for prior authorizations made by payers. The providers are doing their best to keep up to and proactively follow on any procedures that do require an authorization now. But often than not, they have to react to these once the claim has been denied on the back end. Speaking to Kristen's point earlier, where taking the learnings of denials and write-offs and triaging that back to the front to identify the right root causes to prevent them in the future. So I'd love to just take a step back again and just explain, why are all of these challenges worth addressing? You know, to first start off here is 90% of the denials that we see on the front end are quite preventable, and 70 to 82% of them are overturned. But unfortunately, 60% of these denials are never worked due to the lack of knowledge or due to the time and cost it takes for staff. For example, in a physician setting, it might cost the organization $25 per account, or in an acute setting, $100 per account to actually work each denial. Compound that over large denial volumes and lack of staff capacity, this leads to more potential write-offs and pitfalls. And with staff having to spend more time triaging and talking through taking on additional roles and responsibilities to overturn these denials, there's a direct correlation between staff spending too much time on these low volume complexity tasks and missing the higher dollar opportunities. And this can increase human-prone errors and productivity issues, resulting in higher probability of write-offs. So with that, Kristen, I'd love to chat with you again to see how you have empowered your revenue cycle staff to have improved and scalable performance within the Care New England organization.
Sure, thanks, David. So it's actually officially been 1 year now since Care New England said to ourselves, this cannot be the best this workflow can be surrounding our authorizations. We always felt like we were operating behind instead of up front, which, as we know, is where authorizations should really happen. So as an outcome, we experienced a lot of manual errors and denials, which resulted in appeals and, if lost, write-offs. Our operations were also not a satisfier for patients. So since we were operating short-staffed and high volume, we often had to move appointments or cancel. I'm sure we were losing patients in the meantime. And that's also a data point we were never able to track. We therefore set some strategic goals with Notable for where we could best improve in a short amount of time and with the biggest bang. Care New England didn't feel like adding FTEs would really ever get to the root cause of the problem. Notification of admissions were increasing, with payer mix changes and more services requiring authorization than ever, and the means for how to obtain either one of those being different based on plan and product. So this slide here showcases some of the major barriers Care New England experiences when verifying or obtaining authorization for our scheduled visits. As previously mentioned, the various payer requirements remain the #1 issue for staff to be able to decipher and notate encounters accurately. Even if guides or tip sheets are created, which we have tried many, the payer policies changing often make them useless long-term. Some other things for us to consider is ensuring the staff have both understanding and access to enough of the patient's clinical record to support the authorization on hand if needed. And lastly, when cases are added late, would we have enough time to prioritize the visit, get the authorization within a day or so, when it generally already takes 3 to 14 days? We want to accomplish all of this without ever affecting the patient. So after having our issues clearly outlined and our needs with Notable, we felt moving forward some processes to automation was the next best step for our team. Our vision for automation would result in a decrease of staff frustration by decreasing the sheer volume of accounts being assigned to them. And that was ultimately causing our morale deflation. And it ties us back to that staff retention. So we also envisioned elevating the accuracy and the productivity, along with the overall productivity increases in account completion. Lastly, process standardization, documentation, and cross-training were also important to us. These goals became realistic in partnering with Notable. So I feel as though this slide here is very appropriately titled Our Notable. A sometimes huge complication for Care New England that I've not previously mentioned is that we actually operate on 2 EHRs. So we are never, ever an out-of-box implementation. We needed a partner that would work with Care New England for what we needed and to mold to our systems and workflow. We got that with the Notable team. Knowing our losses, we chose to put our focus first on notice of admissions for our 3 major payers for 2 of our inpatient operating units. Notable spent time shadowing our management team on system use, both of our CNE systems and the payer portals, along with reviewing the payer requirements. So in these exercises, we documented every step, and it was a great learning process to create material for Care New England too, for onboarding, and also identify where we were falling short in the processes. We were able to collaborate and work on this together. Notable was able to build those workflows for automation through those shadow sessions and build any of the exception rules that we wanted in place. As a result, Notable was able to power their bots or digital assistants to log right into our EHR and run the information just as we train our staff. The digital assistants access the payer portals to validate and submit information and then notate the Care New England work driver on all of the efforts and outcomes. So this slide here depicts a bit greater detail how that workflow operates. The digital assistants are not held back by the time of day or day of week. The volume the digital assistants can complete is also much higher than the staff, to which again, we transition to the harder manual work too. There will still be many processes that cannot be automated, such as phone calls or outlier cases that will require the staff to manually intervene. However, these manual processes now stand out in our rev cycle team, and we're able to bring those back to the payers that may be behind in processes to not allow us to achieve such automation. These conversations and bringing to light callouts are important to continue to move forward. Outlined here, you can see some compiled data of the successes over the last year. By achieving the goals we set, we saw improved movement in our important KPIs for both denials and write-offs. The success rate on our notice of admissions has driven a lot of that. It was 644,000 write-off savings, and the staff hours saved in this time, along with the new improved accuracy in those hours, has changed the overall outcome of this team. With these types of results, Care New England is looking forward what's to come and how we will continue on this path.
That's amazing to hear. And thank you for sharing those results, Kristen. I love that, a lot of things I hear with other revenue cycle leaders is how do I get my staff to actually work top of license, right? To actually do really meaningful, impactful work that they're employed to do and to help the organizations and patients with. So that's just a great story. And I'm really glad that we were able to be part of that journey with you. So I think, transitioning to the last final challenge, and that's patients will have a higher expectation for their financial and digital experience going into 2023. And the reality is that the financial burden has shifted to the consumer, which has created a ripple effect to providers. The ubiquity of high deductible health plans have made consumers the nation's largest payer after Medicare and Medicaid. And as you can see in the data, from 2019 to 2022, we can see that these high deductible plans have risen by 23% across all firms. patients are feeling the burden of higher deductible plans in exchange for a sustainable monthly payment for their insurances. And providers are ultimately faced with that challenge and responsibility to collect for this. And with that challenge, they're having to create new operational and training strategies for staff to collect from the patients. The shift of the financial burden to the consumer and the lack of appropriate tools to help manage their obligations has led to very predictable results. More than 50% of Americans have medical debt of at least $1,000, and more than 2/3 of consumers under the age of 65 say they struggle making these payments. And this adds to the general consensus that 93% of patients believe healthcare is just too expensive. So imagine being a patient, you're coming in, but you have a guarded and insecure feeling of what you're going in to get your care for only because you're worried about the financial burden and unknown outcomes from that after services have been rendered. And this again leads to a negative impact to the way patients view healthcare. This patient reality isn't just hard for them, but also incredibly difficult for organizations to collect from the patients, especially when they don't know what to expect. And according to a study by HFMA back in October 2020, they evaluated that the pandemic had affected priorities and consumerism strategies. They confirmed that organizations are having more challenges collecting from patients, and it's to no surprise on the 3 statistics I'm about to share. The first is that a little over 80% were finding it more difficult to collect from patients. About 70% of respondents shared that they were seeing more accounts going to collections, bad debt, and writing them off. And then 80% or so stated that they are taking longer and seeing a longer trend in trying to collect from patients with high deductible plans. And in addition to that, things are not getting cheaper these days. It's actually costing provider organizations 4 times more to collect from patients in this day and age. So overall, 56% of patients would consider switching providers for a better healthcare payment experience, especially if they didn't have one in their current state. It used to be that the consumer financial journey started where the clinical journey ended. And typically now, copays were often collected at the point of service. But in today's digital world, payment opportunities are moving up even further upstream, such as through scheduling departments, call centers, or even with mobile apps that patients can interface with. And providing these upstream collection opportunities for patients, the patient financial experience should have these core considerations taken into place when providers move these upstream. And the first is that providing patient estimates to allow the patient to know what their financial experience obligations are without any additional surprises. Second, allowing for a convenient payment option such as Apple Pay or Google Pay to increase the likelihood of full payment. And third, which I think is incredibly important, is the personalization of it all, giving the right tools for patients and providers to mutually manage the financial obligations. And such things are like payment plans. So with that, Kristen, I'd love to get your thoughts on how automation has helped your organization shape the patient experience, and also just talking about what's ahead for you as an organization in 2023. So I think the first question, going back to a really awesome statistic that you shared, was Care New England has achieved an 80% decrease in authorization reduction time to schedule. How do you think this has shaped the patient experience and outcome? And I would love to hear how it's impacted patient care as well.
Yeah, thanks, David. I think one thing that's been consistent throughout the webinar today is the importance of the patient. And a lot of work that we're doing is to create a path of seamless care to the patient. Over this last year, we've seen less rescheduling, less complaints, and less overall cancellation. By allowing our staff time to work encounters accurately and effectively, the patient does not even know what's happening in the background, as they never should. Most people who are not in healthcare have no idea of all the steps that are taken before, during, and after their care that is occurring, and it really should remain that way. Our struggle should never be passed on to the patient.
Yeah, I very much agree with that. And, sharing like a personal story, I remember I was going in for a procedure and I knew it needed an authorization. And, bless the person on the receiving end, but I was asking them all these questions and they're like, do you work in the industry? And I was like, I sure do. So, but I think about that and I think about how so many people and individuals shouldn't have to worry about that, right? Knowing that they can get something scheduled and moved on for a procedure and given their care without worrying about the struggles of what's happening behind the scenes to get that service rendered. So I think the next question I have for you is about the future. What's ahead for your team as you guys scale to 2023?
Yeah, there are so many things I'm looking forward to in the future. We hope to partner with notable and high volume, high dollar cases for insurance verification. You had presented in your slides that it was the largest reason for denial. So we're hoping to get some traction there. This will help appropriately assign work in a prioritized manner. It will also help drive even greater accuracy with the No Surprises Act and estimation requirements for our out-of-network patients. We also hope to expand on the work we are currently doing by adding additional payers into those current processes that we already have. And then as far as access, access is so important. I think I have a lot of visions for pre-registration, scheduling, and the overall patient experience for the coming year for Care New England. It will all be one step at a time to be able to appropriately resource and finance those endeavors, but that's what I'm most looking forward to.
Yeah, that's great. And, just to piggyback on the No Surprise Act in the future, I think the most important item here is that, registering the patient with the right insurance is the first and most important step to ensuring that they have the right estimate, right? To ensure that, there are no surprises down the road. So I'm excited to partner with you in the future for that as well. But, to wrap this up, as we head into the towards the last couple slides, I mentioned earlier that many organizations still follow a status quo to solve for these four challenges, but unfortunately, that same status quo contributes to it. And revenue cycle processes are saturated with manual flows that frustrates patients, staffs, and providers. Patients are asked to provide the same information over and over again during the scheduling process or even check-in. Or when they're looking to get something scheduled for a procedure, they're not sure if an authorization is required or not, or they don't even know at all. And it leaves them to either wait or follow up with the provider to see if they can move forward with their care. And finally, from a staff perspective, they're being forced to multitask to levels that just increase the likelihood of making errors. And this is compounded by the fact that most information that they're collecting happens to be on paper and is manual. And for example, staff have to traverse between the EHR and different payer portals to find discrete and repetitive information that's required for things such as authorization submissions. And from a provider perspective, all of these inefficiencies for the systems and different workflows result in not getting paid for services that they provide. And it's ultimately a lose-lose for everyone in this situation. So thinking about how does Notable address these pitfalls? Our intelligent automation platform sits on top of your EHR, so your organization does not need to invest in incremental point solutions. Our intelligence empowers patients with a guided experience and frees staff to focus on supporting patients with a touchless workflow and delivers organization-wide impact. So how does this translate to reality? From a patient perspective, patients engage with a web-based application, and this could be for completion such as intake or scheduling an appointment, or even confirming or canceling an existing appointment. And from a staff perspective, they no longer have to enter repetitive data, or for things like authorizations, have to check and see if an authorization is required, checking the status, or even perform the submissions. Our configurable rules engine and AI takes that high fidelity data captured from patients or authorizations information and makes sense of it. And finally, our digital assistants complete the final steps of writing this information back into the discrete fields of the EHR to complete the account and move on to the next one. The notable solution is quite vast, and I wanted to just share the 5 areas where we have helped organizations and health systems accelerate their patient access, revenue cycle, and growth initiatives. All these solutions are powered by Notable's single intelligent automation platform. And these solutions are composed of different flows, as you'll see in the white box for each of the different areas. And these flows are what we have been able to help support with our current customers and partners today. We've been incredibly privileged to partner with organizations like Care New England to drive these results and obsess over outcomes that Kristen shared earlier. And as we look forward towards 2023 and beyond, we believe that intelligent automation challenges that status quo to create a sustainable and scalable approach to these challenges that we spoke about today. So with that, Kristen, I want to thank you so much again for helping me lead this webinar today and for everyone that's attended. I would love to open up the time now for Q&A and if there's any questions that we can help answer.